My name is Erika. I'm an ICU nurse at MHealth Fairview Southdale. Deeply concerning for me as an MHealth Fairview nurse is the threat of a merger of our employer with Sanford Health. As a 25-year employee of Fairview, I'm alarmed that a Minnesota institution can be bought and sold to an out-of-state entity. This proposed merger is very personal to me, my employer, my hospital where both my children were born, my family's medical needs, and even cochlear implant surgeries for my child at the prestigious University of Minnesota Healthcare. Minnesota is known for its superior healthcare. Healthcare put Minnesota on the map. People travel from around the world to receive care here, care that every Minnesotan has come to expect. Nursing care elevates the patient's experience, provides vast improvements in our outcomes for those patients served in our state. Our nursing practice thrives in the state of Minnesota because of our nursing union. The Minnesota Nurses Association drives the standard of excellence throughout our state, ensuring that patients are cared for safely. Worrisome for me, as a union nurse, what happens when an employer buys out a system? Is our contract recognized? Do we need to fight all over again to keep the high standards and protections our contract provides to the practice of nursing and for patient care? As we settled our contract with MHealth Fairview this past December, the negotiating team attempted to bargain specific language that would provide some level of protection for our fiercely fought-for contract. MHealth Fairview refused to sign our preferred language, instead only agreeing to language that essentially states that Sanford must acknowledge our union. This is not protection. It likely would mean that we would have to renegotiate our entire contract. In recent years, MHealth Fairview has made significant changes in the landscape of healthcare here in the Twin Cities, buying Health East and then closing 2 hospitals within that system. The 2 hospitals had large significance in our community. Bethesda, one of 2 long-term care hospitals where patients with prolonged critical illness go to recover, and St. Joe's, a critical hospital in downtown St. Paul that served the underprivileged and mental health patients. Both shuttered hospitals were not money makers, but essential for our community's health. These examples of profit-driven decisions should alarm Minnesotans. A merger with Sanford Health and MHealth Fairview will not offer more. What's next on the closure list? What assurances do we have as Minnesotans that our quality care will remain? We all need to be aware and fight back against the next steps in the landscape changes in healthcare in Minnesota.
Good evening, everyone. Roach, Executive Director of the Minnesota Nurses Association, ROSE, ROACH. And we represent 22,000 nurses in Minnesota, Iowa, North Dakota, and Wisconsin. Many work in the Fairview and Sanford and/or Sanford system. The United States of America ranks 40th in the world for life expectancy, declining over the past 10 years. Declining life expectancy, yet health spending has increased by 87% from 2000 to 2019. Well, guess what? Those same past 10 years correlate with the growth of these large corporate healthcare systems. Paying more for less in healthcare, that translates into people's lives, literally lives. That's unacceptable. The impact of the merger mania has been underinvestment and abandonment of rural hospitals and services. Even worse, healthcare for minority populations, higher healthcare prices and insurance premiums, greater distance between decision makers and the people that are affected by the decision, and decreased autonomy of doctors, nurses, and patients. During 2021 and 2022, a frenzy of merger and acquisition activity resulted in more private equity involvement in healthcare. Studies show that healthcare mergers have caused a 41% increase in prices with no evidence of improved quality of care. What we need is public stewardship and oversight, wherein the hospital is accountable to us, the public, not these independent profit-making entities that focus on generating revenue. Hospital CEOs are on a quest to amass ever larger reserves through marketing campaigns and acquisition strategies to increase their market share and dominance. The problem is, these are business strategies, not community health strategies. The bottom line, we must stop this corporate takeover, return hospitals to serving as a community asset, and ultimately put patients before profits. Thank you. And with that, we will open up questions.
Has MNA had conversations with Sanford about the contract issue? issue of whether the contracts that were just reached will be honored?
Well, you heard Erika. I mean, no, not other than at the bargaining table. And they were told at the bargaining, we were told at the bargaining table they wouldn't give us the language we had proposed to ensure that the contract would follow, right, a successor. Owner of the facilities. So we are stuck wondering the same thing. Oh, they get to acknowledge the union. What does that mean? What does that mean? We don't know.
Have you heard from Sanford?
No.
I can tell you that I was part of the Fairview Health takeover. I was a nurse at Fairview at the University of Minnesota Medical Center in 1996, before, during, and after the Fairview takeover of University of Minnesota Medical Center. They made sure that the nurses at the University of Minnesota would not be covered by labor contracts when they took over the university. So,
Still just
A&NE, my name is a 4-letter word.
well, I mean, but they did that. They didn't do a straight contract. Yeah.
That study that was a 41% increase, what study are you referring to?
You know what, let me get back to you, because I just pulled it off of a report today, and I didn't write down the source, but I will get that for you. But that's a pretty common statistic that we are seeing, because this is happening all over the country, right? And so we're seeing that. There's been a lot of studies about trying to see, is this really something that is a benefit, both in cost containment and price, but also for patient care? And we're not seeing it do either of the things that they promised. As Gary said, corporations have a different sort of focus.
There are several meetings scheduled, public meetings. Are you guys planning to be at all of them?
Absolutely. Yes. Yes. Yep. We represent nurses in all of the areas where these look. And I believe SEIU also represents in most of those areas. The farmers obviously are spread out across the state as well. So we're working in coalition with a lot of different organizations and labor unions who do not see this as a benefit to them.